Now, 3 healthcare tips.
Women should always go for their antenatal visits.
Preventative health care.
Annual medical checkup.
Never self-medicate child.
The earlier you present to the hospital for treatment, the better for your care. Early presentation leads to better care. That's one. The second tip I will give to those watching this is always discuss your problems with your doctor. And that includes medical advices given to you by non-medical people. Take, for example, a friend tells you to take a particular drug, and you know quite well that that friend is not a doctor. No matter how convincing the friend's argument is, the best thing for you to do is that you should discuss it with your doctor, and the doctor will be able to educate you on the rightness or otherwise of such an advice. Then the third tip I will give to my patients is to be aware of hygiene. What I call hygiene awareness. Most of the illnesses we pick up in Nigeria are infective illnesses. And infection comes when your personal hygiene is relegated to the background. You have to make sure that you wash your hands and you take care of your general body hygiene.
As a woman grows older, the chances that she would achieve a pregnancy starts to decrease. And it starts to decrease at around age 35. So if you're looking on getting pregnant easily, then it's very important that you try and achieve it before age 35. Infertility, as it's defined, is inability to achieve a pregnancy within 1 year of actively trying with unprotected intercourse. And in a newly married couple, it is very important that they try and achieve this as early as possible during their reproductive life and not leave it too late. Preventative health care is the way to go. You should not wait until you are ill before you access health care. Ideally, every adult Nigerian should be going to the hospital for regular checkups.
When you are sick, consult your doctor. Rather than go to an over-the-counter pharmacy or whatever to go and procure drugs on your own. Not all ailments are what you assume it is. So you seek help easily and go to a recognized health facility where you'll be able to seek help easily. Then, of course, for the women folk, annual medical checkup, especially cervical pap smear for our women folks, because we know that one of the most preventable cancer of the woman is cervical cancer. So they should do their routine pap smear and all that. So those are the areas where they should look at.
Baby friendly. Baby friendly is when the mother feeds the baby solely on breast milk from day 1 to 6 months with no additional things like a formula or water or whatever. Everything is breast milk. And of course, when you do this, you're passing a lot of immunity into the baby to keep the baby growing. And another information you want to pass across is immunization. When the baby is well fed and it has enough immunity from the mother, coupled with the immunization schedule that the nurse will give you dates to come for, and if you adhere to it, you are sure of a healthy baby all through the life of that baby. Now, what you can again say is the diet of the mother. If a mother is well fed from the time of antenatal to the time of breastfeeding, she has enough breast milk to take care of the baby for the next 6 months.
not underestimating the symptoms of your child. If a child complains of makes certain complaints, you should always take it serious. Secondly, listening to neighbors as regards certain things. For instance, teething. The period of teething has been known to coincide with times when when children have certain health challenges, and such is assumed to be as a result of teething. So you shouldn't listen to neighbors when they tell you certain things about your child's healthcare if that person is not a medical or a healthcare practitioner. And then thirdly, I would rather a mother or a father or whichever family member, which is an adult, takes medications for himself than to give medications to a child if it's not prescribed. Because when the child starts having problems, you can tell. But when the adult starts having problems from the medication, you can at least make certain complaints. So never self-medicate a child.
Women should always go for their antenatal visits, and this is very, very crucial, and they must ensure that they deliver in safe places, especially in St. Ives. Women are also encouraged. They are also encouraged to also do their regular checkup, as the incidence of cervical cancer is also on the increase, also this breast cancer. And they need to be aware that they need to come for checkup, regular examination, and the pap smear is also very, very vital in terms of prevention of cervical cancer. And for those that are not also immunized against cervical cancer, should also come around for cervical vaccination, which has been shown to reduce the incidence of cervical cancer. Despite this was originally meant for ladies that are around the period of between 10 to 12, 13 years. But for those that are HPV negative, can also get themselves vaccinated.
I must say, first of all, there are a lot of men who are going sterile who probably have challenges with their fertility. So I would advise young men to please watch their lifestyle, try to reduce their consumption of alcohol, and those of them that probably do drugs should please stop doing drugs, as this could affect their sperm counts. More so, STDs should be treated early, as this might also block the testicles and also make the sperm count low. More tips, consume more vegetables rather than having processed food, as the rate of infertility is on the increase now.